what I'd like to do is actually take you through an experience in both parts of my world to say why this is so important. I just got a call about a month ago from a man that actually I'd seen when I just started in pulmonary medicine. And he was a longtime smoker, and he had presented to his internist because his neck was thick and he couldn't tie his tie. The short story is that he had a small lung cancer that was compressing him on the blood vessels in his chest. He was 50 years old. This was a direct consequence of his smoking. Now, his story is unique because he actually went into a clinical trial for a new treatment for lung cancer, was able to be cured with surgery, and he continues to call me 14 years later because he wants to tell me what he did with each of those years of life. He's taken me through his youngest daughter's graduation, the birth of his grandchildren, and he reminds me every time he calls that, why do I remember his story? He calls because he's the lucky one. The World Lung Foundation's work on tobacco control, not just in the United States but globally, is going to be the type of work that means that we're not going to have to worry that I only have one lung cancer survivor 14 years later. The other part of my life is actually in Eldoret, Kenya, where Brown has a medical exchange program and where I do much of my tuberculosis work. The World Lung Foundation, I think, is one of the best organizations at raising the awareness of what tuberculosis does in the world today with its association with the union. I want to tell you the story of one of my patients there that, again, is just makes me appreciate being on the board every day. About 4 years ago, I was rounding on the wards with my team in Eldoret, Kenya, and we came across this young woman. She couldn't stand up because she was so short of breath, and she actually had a form of tuberculosis that affects the sac around the heart. And the pressure that was built up because of this infection caused it so that her heart couldn't pump and she couldn't even sit up. We're lucky at this hospital to actually have a thoracic surgeon. We went and talked to him and he said, I can drain this pus and she'll be able to be treated. The other thing, though, she had HIV-related tuberculosis. We were very lucky at that point to just be starting an HIV care program, which is another one of the things that World Lung Foundation, although people may not think of it as HIV as a lung disease, really helps to promote. But Rachel that day got her heart surgery. She started 9 months of tuberculosis care. Following that, she was patient number 4 in our HIV care program. And a year later, she finished her human research certification through my university to become our first research assistant in our HIV care program. The World Lung Foundation, through its international work to actually promote lung health by promoting tuberculosis treatment, tuberculosis awareness, really makes that kind of story happen. You know, those are just one story in each spot. I could tell you a story for every moment of the day when I work either at my site in Kenya or in my pulmonary practice in Rhode Island about the burden of lung diseases, whether they're infections in the developing world or tobacco-related lung injury in the United States. Every one of those interactions makes me aware of the importance of the kind of work that WLF does in tobacco control, promoting lung health. And that's why I'm happy that I actually get the opportunity to serve on the board, to really give back and say, I see the people that are affected every day that need the help of an organization like this.